That's more important than measuring the tumor, doing a scan, doing blood. All that stuff, it doesn't matter. Because in the end, listen, does anybody here have a contract with God? You have a contract with God? He guaranteed that you'll be alive tomorrow? Nobody has a contract with God. Right? I could get hit by a car. Right? Lightning could strike the house. I had a poor unfortunate boy. He was a teenager. He walked in his house, slipped on his rug, and he became quadriplegic. In other words, we don't know what's going to happen tomorrow. So what's the most important day of our life? It's today. So today, can you eat? Can you sleep? Can you laugh? So really, we all have the same prognosis. We're all here by the grace of God, and we'll be here tomorrow by the grace of God. We have to keep that in mind. I had a woman who had breast cancer all over her body. And her lymph nodes were so matted, she couldn't lift her arm. It would hurt. So I talked to her about the fasting, cleansing, all those things, meditation, prayer, yoga, all these different things, working on relationships, all these things, and all the IV treatments. And she said, I don't want to do any IV treatments, I just want to change my life. So I said, okay, well, at least come in once a month so I can check. So she did the fasting, the cleansing, and she came in, and every month she could move her arm more and more. So that was June. I met her in June 2001. In December, everything was great. She was perfect. In January, she had an automobile accident and died. When they did the autopsy, there was no cancer. So, it was her time. And her husband told me that even though she was dead, he doesn't feel as bad as he would have if she had died from the cancer. Because he said these last 6 months, she was living, not dying. So these are just the different associations that are now formed. So the field of integrative oncology is becoming standardized. This, the International Organization for Integrative, I was one of the founders of this, and this is another thing I have in Singapore and all that. So we have there's four pillars to dealing with cancer. Number one, you got to stop making cancer, because if you don't stop producing cancer, it doesn't matter how good the doctor is at getting rid of it, it'll be back. Right? So if you've got a lung cancer and if you don't stop smoking, in fact, think about it. If a patient had lung cancer and they came and they wouldn't quit smoking, should I treat them anyway? It would sort of be unethical, wouldn't it? It would just be collecting money, knowing they can't possibly get better. The next thing we do is we want to target the cancer, not the healthy cells, and eliminate the cancer without causing any harm. The third thing we want to do is wake up the immune system, because the immune system, if it's awake and it's healthy, you can't have cancer. And this is the most important thing, knowing. And what I mean by knowing is, you all know the word faith? Most people think that faith means believing in something. But if you believe in something, that means you have doubt also. If you know something, you have no doubt. There's a difference between believing and knowing. Okay? So if you ask me if I believe in God, I would say no. I know about God. Okay. Do you believe in gravity? Do you believe in mountains? Do you believe in Santa Claus? Okay, you see, so Santa Claus you can believe in. Tooth fairies you can believe in. But you don't believe in mountains. You either know about them or you don't. So that which is true you know or you don't. And that which is not true you believe or you don't believe. So be careful when you use the words. At least English. I don't know about your language, but in English it's very clear. If you believe in something, that means you also have doubt. Right? So if your husband or wife, if the wife says to the husband, I believe you, that means she also doubts him. Right. So in the faith is when you know what's going to happen and it hasn't happened yet. Right? That's faith. So the simple thing to keep in mind is you cut your finger, you don't believe it's going to heal, you know it's going to heal. There's no doubt. You just clean it off and put a Band-Aid on it and you know it. Well, when you know, if you have cancer and you know it'll be gone, it'll be gone. I had a woman come in, again, stage 4 breast cancer. It was in her lung, she couldn't breathe, she was lying on a gurney, she had a respirator in. She came to see me because she just came from her doctor and her doctor said you have 3 weeks to live. Which was a lie. He doesn't even know how long he's going to live. I want to meet that guy because I want to ask him, by the way, how long is Obama going to, or Trump? Do we have to, another 4 years? No, he doesn't know. It's a lie. But if you have a white coat and you lie, it's called a medical opinion, so it's okay. Anyway, what was I saying? Oh, yeah. So this woman, thank you. So this woman was lying there and on the gurney, and I walked up to her. She grabbed my arm, and she said, "Thank God, now I know I'm going to make it. Now I know I'm going to live." 8 weeks later, she was jogging to the clinic. Her husband was driving behind her, make sure she was okay. 8 years later, I get a postcard from Paris. She was on vacation. And that's because she knew it. She knew it. And what's the difference between her and the other lady next to her who didn't know it? That's the difference. So you got to know it. So my job as a doctor is not to come up with protocols. My job is to inspire you and to teach you, to give you the knowledge for you to know that this body is an amazing miracle and it heals. And I can show you research done with all different sorts of animals, showing that no matter how badly their lifestyle was, if you stop it, you clean up, you do some fasting, cleansing, and then you eat, the body is amazing. So I want to try to get to some of the therapies. So stop making cancer. So basically this is the aquarium analogy. I say this every time I talk, but if you had an aquarium and the fish were sick, the veterinarian would not say, "Bring me a fish." Say, "Bring me a cup of the water and I'll tell you what's wrong with the fish." And you can put medicine in the aquarium